Good afternoon, ladies and gentlemen. Thank you for joining us and welcome to our webinar on the healthy voice and throat. My name is Dr. Ronda Alexander. I'm an assistant professor of otolaryngology and head and neck surgery at the University of Texas Medical School at Houston, and I'm director of the Texas Voice Performance Institute at the UT Medical School, as well as the comprehensive voice program here at Memorial Hermann in the Medical Center. Now, as you may notice, my voice is not exactly sounding healthy. I caught a little bit of a nasty bug over the weekend, but I am doing some of the right things that we will talk about later to support myself through this little illness, this little bump in the road. So what we'll do is we'll review together today. First of all, the fact that I have no financial or other investment commitments which would interfere with the impartiality of what we're going to talk about today. We're going to talk about the source of your voice, where it comes from, how it works, how it can go wrong, and importantly, how to fix it, and some things that we can do to preserve our voice health. So just to get a better understanding of why voice problems are important, there was a study which was published earlier this year in one of our ear, nose, and throat journals, scientific journals, which did a survey of people who were going to the doctor for reasons not related to their voice. So of people who were going in for, let's say, a blood pressure check or for a low-level injury to a finger or an arm, 1 in 13 of those people, when we gave them a survey that asked them about their voice, actually had a medical voice problem. And of those people, more than half of them had already missed work due to their voice problem. In addition, about 10%, so 1 in 10, had had more than one episode of a bad voice over about the past year at that point in time. So what are some of the reasons why people do not get care for their voices? One of the reasons that the patients told us was that their doctors didn't ask them about it, and so they didn't think it was important. And that's reflected in the fact that only about 1/5 of them had any treatment for their voice. And that consisted of some of the things that we will talk about later. In addition, there were just informational issues. They didn't know that there were physicians who were specifically trained to take care of the voice, or that there anything that could be done about voice problems. And what we're going to do today is hopefully dispel some of those myths. You already know that there are professionals who can treat it, among them being myself, but also that some of these voice problems can be helped. So where does your voice come from? The voice comes from an area in the throat called the larynx. Now, the larynx lives inside of a cartilage cage, which we usually refer to as the voice box. That cartilage cage is the thyroid cartilage, which you can see the label on that blue V-shaped structure right in the middle of that picture. Now, in gentlemen, that area called the notch on that right-sided label, that's your Adam's apple. Now, while ladies don't have an Adam's apple, we all have a thyroid cartilage, and unless you've had surgery to take it out, we all have a larynx. Just below it, you can see labeled the cricoid cartilage. This is the main structural support of your airway. It's kind of like the I-beam that helps keep everything open, and everything else is really suspended from the cricoid cartilage down until we get into the lungs. We'll take another look at it from the side. At the top of the picture, you can see a label that says epiglottis. Now, the epiglottis is the guardian of your airway, and we'll see it in some of the live pictures later. What it serves to do is to help cover and protect the vocal cords, which are the entranceway into the air passage, so that food and drink do not go into the air passage and instead go down the side channels into the food pipe towards the esophagus, as they should. In the center of the picture, we can see the thyroid cartilage cut in half. This is a picture of the voice box opened like a book so that we're looking from the middle towards the right side. And we can see that the cricoid cartilage rides higher in the back, and that's where the vocal cords are actually seated at the back end, and that they attach through this vocal ligament. You can see the label on the left side. The vocal ligament is the main structural support of the vocal cords. It allows them to be attached at the front and the back of the voice box to allow them to move normally. So what makes a good voice? So a good voice comes from The power source, which is a healthy lower airway in that the lungs and windpipe are open and functioning normally. Add to that a healthy voice box, so vocal cords that move normally, come all the way together, don't have any lumps and bumps on them, and are soft enough to vibrate and produce sound. And then finally, the one which is deranged in me today, healthy sound shapers or resonators. That's going to consist of your sinuses and your nose. And you can see that by changing my resonator, this is not my normal sound. You can mimic this same thing by closing your nose off with your fingers and trying to make your normal voice, and you'll see that it does have a different character. In addition to the resonator effect, we also have sound shaping by the lips, tongue, teeth, and throat. Now, of course, a good voice is different in different cultures. While here in the West, we tend to make one sound and call that normal, there are Tibetan throat singers who are trained in their culture to make multiple sounds with multiple parts of their resonating system so they can make more than one note at once. And so a good voice is always culturally determined, but here in the West, we like to make one sound at a time. So how do we support that first aspect, the good power source, with good breathing? Good breathing comes from your diaphragm. Now, your diaphragm is the big muscle underneath your lungs, which contracts and essentially sucks air from the outside into your lungs. In order for your diaphragm to be in charge of your breathing, you need to be able to move your belly. Okay? Using your diaphragm to breathe will give you the best efficiency for speaking and lead to the least of tired feeling because you won't be putting as much stress on your voice. Now, because you need to move your belly and intestines out of the way for the diaphragm to work well, it doesn't work when you have one tight closed. Now, if you think about it, when you see those opera singers in their costumes, usually looking like Vikings, none of them has a tight waist on. They all have empire waist so that their bellies will be able to move freely while they're singing. And you know that they have great endurance because to be able to make it through 2 hours of performance with not just the endurance of what they're doing, but the volume they need to make is quite a feat, and it's an athletic endeavor in and of itself. So let's take a look at the vocal passage itself, where the vibration comes from. This is the second part of that, the parts that make the voice. Now, this is a picture where we're looking at someone head on, but we've cut them so that the front part opens up like a book, and we're right at where the vocal cords are meeting in the throat. We can see that it's segmented into three areas: the supraglottis, or above the vocal cords, the glottis, or the vocal folds themselves, and the subglottis, the area immediately below the vocal cords. These three areas each play their own role in generating the pressures and vibrations of speech, as well as helping to ensure that food does not go into this passageway. So how do the vocal cords make their sound? This 10-step diagram gives us an image of the physics of how the voice works. Now, don't get freaked out because I said physics. It's very simple. We start out in picture 1, and the vocal cords are closed. As they're closed, we begin to breathe outward, and that pressure begins to open up the lower edge of the vocal cord. The pressure continues to build, and the wave continues such that only the tip top of the vocal cords are touching, so progressing from 1 to 2 to 3. Now, in picture 4, we are able to achieve a brief separation in the vocal cords because the pressure has overcome the closure force. Once the air begins to pass, though, in picture 5, it's pressing less strongly on the sides of the vocal cords, and therefore it begins to suck them in picture 6. You can see the bottom lip of the vocal cords beginning to come together. They're even closer in 7 as that fast-moving air whooshes by. And then in 8 and 9, they've made contact and are beginning to close, which you see in 10. Now notice that picture 10 looks exactly like picture 1, and that's because the cycle begins all over again. This cycle happens at a frequency between 200 and 350 times each second. Now, think about that. 300 times a second is a lot of work and a lot of pressure and a lot of demand that we're placing on these tiny vocal folds. Here are some still shots of the voice in action. On the left picture, you can see an endoscopic, which means that we place the camera through the mouth and are looking down at the vocal cords. This is a view of the vocal cords when they are closed. This is one of the sequence of images which you'll see that correlate with that graphic that we had of the 10 phases of the vocal cord motion in vibration. This is the closed phase, so this is pictures 1 and 10. Now the photograph on the right is different. This camera is looking at the vocal cords in their breathing position. So breathing is open, speaking and swallowing on the left is closed. Now let's talk about the three voices which we all need to use under the right circumstances. The first voice is called the confidential voice. And this is a voice which I usually will encourage my patients with an injured voice to use when they are using their voice. And truthfully, it's one that we should live in most of the time. A confidential voice is the voice that I would use to tell one of my friends a secret in a room where the door was open and people could pass by. So this would be an example of my confidential voice. If you're close to me, you can hear what I'm saying. But if you're outside, you may not be able to. That confidential voice is stress-free and relaxed. And note, it was not a whisper. A whisper like this actually puts more pressure on the vocal cords and more tension in the muscles around the voice box. Now, the next voice, which many of us who use our voices to earn our living do need to rely on heavily, is the public voice. The public voice is somewhat more projected, so I'm trying to reach a larger audience. I may be speaking more loudly, but again, I keep my neck relaxed, and I am breathing from my belly, even though you can't see me. I do speak in my public voice when I'm giving any kind of lecture, but when I'm talking to my patients, we use something in between confidential and public so that they can hear me, but I am not stressing my voice since I need to be able to speak through the entire day. Now, the voice that I rail against using too much is the emergency voice. And the way I explain this to most people, I say the emergency voice is to be used when someone is about to be struck by a vehicle, be shot, or is on fire. It's for emergencies only. Now, as children, we tend to use the emergency voice frequently, particularly when we're outside. That's another name that we call this by, the outside voice. I would consider the inside voice that we often ask children to use to be something between confidential and public. It requires a certain level of maturity, certainly, to be able to modulate between the two. But we certainly want to encourage, when we're speaking to our loved ones and to our children in particular, whether they're related to us or not, that we should avoid the emergency voice. First, it's risky for our own voice use. And second, it induces a stress response in the person that we're speaking to and can sometimes override the content of what we're saying with an emotional response. So I'd ask you to rely heavily on your confidential and public voices and leave the emergency for those emergency situations. Now we'll transition into some pictures of some vocal cord issues and voice box health issues and what we can do about each. So, when you have a voice problem, and that's a voice change that lasts for more than 2 weeks, or an increase in the effort that it takes to make your voice, you may feel the need to cry out for help. Now, who should you be asking for help is the next question. You need to assemble a team of people who are trained professionals who are able to get you the best voice possible. Now, along with you, who you should always consider yourself the leader of the team, your co-leader should be your voice doctor. Ideally, that would be a laryngologist, someone who, in addition to their residency training in general otolaryngology, has also completed a fellowship where they learn the special care of the human voice, as well as the surgical and medical management of the disorders that can affect it. We tend to work in a team with a speech-language pathologist. Now, you may be familiar with them for accent reduction or for children with speech problems like stuttering. However, there is a subset of speech-language pathologists who are trained to rehabilitate the voice. And for certain situations, and depending upon how and when you use your voice, you may also need a voice coach. Think of it as your laryngologist is your medical and surgical leader, your speech-language pathologist is your rehabilitation specialist, and if recommended, a voice coach is your fine-tuner. So first, let's take a look at vocal nodules. The vocal nodules in this picture are labeled N. The VF is the vocal fold, also called the vocal cord. I may use those two terms interchangeably. And the two sides are labeled right and left. So vocal cord nodules are usually going to be found on both sides, so on both vocal cords. And the reason that they're a problem is they can interfere with both vibration and closure of the vocal cords. I tend to think of them as calluses. The place on the vocal cord where they tend to develop experiences the largest amount of the force in that 200 to 300 times per second vibration. So they're making the biggest movements and they're subject to the greatest stress. Therefore, they can develop a thickening in this area on the vocal cord, which is similar to the callus that you can develop on your hand or foot. How do we treat them? We treat them both with speech therapy, which can teach you to use your voice in an effective way, which doesn't put as much stress on the vocal cords and helps to soften the nodules, as well as anti-inflammatory medicine, which may consist of steroids to directly decrease inflammation, and may also include antacid medications to help prevent the contribution of reflux from generating additional problems with the vocal nodules. Now, it's important to remember that vocal nodules may not go all the way away, but our goal in treating them is to give them a soft, vibrating texture as well as a low profile to minimize their interference with vibration and closure of the vocal cords. Next, we've been hearing a lot about reflux disease. Now, these pictures illustrate an extreme case where the swelling and inflammation caused by the reflux has so disfigured the voice box that I doubt you could find anything that looks like our previous pictures. So reflux is the backward flow of both acid and digestive enzymes from the stomach up through the food pipe and back onto the voice box. The voice box is the first structure that such contents would encounter, therefore it's at the most risk. It also does not have the protective mechanisms that are found in the esophagus where reflux is expected to happen. Therefore, it has to react by generating swelling and inflammation. It can also generate some scarring, which eventually can interfere with the movement of the vocal cords. Now, commonly, the kind of reflux which will affect the voice happens without heartburn, and you also don't need to be overweight to have it. It's a kind of reflux called laryngopharyngeal reflux disease. That just means voice box and upper throat reflux. And what people will usually tell us they're having is a cough that does not go away, the sensation of throat clearing or and the need to feel and the feeling that there's something in the throat, as well as excessive belching, which may or may not have an unusual odor. Now, how do we treat reflux? Well, we have two main arms. The most important of those arms is rearranging your lifestyle for a healthy stomach and esophagus, your food pipe. We want to minimize our caffeine intake. Now, I know that I can't tell you to have no caffeine, but I would limit it to the morning hours and avoid late night snacking along with that. In order to minimize the physical tendency to have reflux, it's important to stay upright for 2 to 3 hours after your last meal. So don't lean the lazy boy recliner all the way back after dinner. Barring the lifestyle changes making a big difference, we do have medications that we can treat reflux with. For some time, we've had the histamine blockers, and that's things like Pepcid and Axid. Those are some brand names of those drugs. And what they do is they block the chemical signal from the nerves that go to the stomach and slow down acid production. However, in the late 20th century and early 21st century, we had the proton pump inhibitors come on the market, and those are going to be drugs like omeprazole, lansoprazole, esomeprazole. They all end in zole in general. And what they do is they actually block the pump in the stomach that puts acid out. Now, a lot of these medications are available over the counter, but it's important to ask the pharmacist or your physician, particularly if you are on certain heart or blood vessel protective medications. Plavix in particular is one which can be interfered with some of these medications, and we certainly think it would be a shame to have a great healthy stomach and throat and voice, but to have a problem in your heart or brain or arteries in other parts of your body from your platelets not behaving the way your physicians need them to. So always check with your physician or your pharmacist prior to taking these over-the-counter medications. Now we move on to movement problems of the vocal cords. As I said at the beginning, a healthy voice comes from vocal cords that can come all the way together. Now, sometimes after a viral illness, one or both of the vocal cords doesn't move normally. Additionally, if you have certain surgeries of the neck, specifically thyroid gland, or the heart or brain injuries, you can have problems with the nerve that goes to the vocal cord to give it movement. Now, when the vocal cords don't meet because of a movement problem, the voice can become breathy or really harsh as you fight to overcome the poor meeting to make the voice. In addition, that poor closure can contribute to difficulty with swallowing, which can be dangerous and produce a condition called aspiration, where food and drinks go down the wrong pipe into your windpipe rather than into your food pipe. Depending on the circumstances, one or both sides of the vocal cords and voice box can be paralyzed, or you can have a subtle partial weakness also in one or in both. Now, what can we do to get better closure under those circumstances? Well, the first thing is being able to identify it. And again, in order to identify the problem, you need to go to a physician who can actually examine your voice box. Once we establish that there is a problem with closure, my first step is usually to get into voice rehab. Before we start talking about surgeries or anything else like that, I want you to be able to get the best voice you can with what you have. If that voice after rehab training is still not strong enough to get you through the day and your vocal demands, then we can talk about things that can make the closure artificially better. Now, the purpose of these injections, which can be done into vocal cords, is to bulk up the vocal cords and improve their closure. Now, they can be done on a short-term, medium-term, or longer-term basis as injections. And the materials that we use for vocal cord injections are similar to the ones that are used in the face and other parts of the body for wrinkle reduction. They are simply a mass effect of being there to push the vocal cord edge over. The short-term material is usually a material called hyaluronic acid, which is also found in your joints. It's a lubricant, and it will usually last about 3 months. Or in the medium term is a thing called micronized dermis. Now, that is an injection which is made out of a component of your skin. When it's taken out of the skin context and made into the small particles, it will last about 6 months or a little bit longer in some people. And then finally, there's a very long-term injection which has clinical evidence of working as long as 2 years. Now, that one is made up of a kind of a bone dust called hydroxyapatite. It's a commercially available product. Now, these injections of any of these materials can be performed either in the office or in the operating room, but it depends heavily on the individual's needs where that should take place. Only after consulting with a physician who is trained in performing these injections into the voice box can it be decided what the best place and the best technique and the best material are for you should you need it. Now, back to some pictures of things that are wrong with a vocal cord. The top left picture shows us a vocal cord polyp. And I think it's fairly obvious that on the side labeled R for right, under the word polyp, there's a red fleshy mass which is pooching off of the edge of the vocal cord. I think you can see in the lower picture how it interferes with closure. It also will interfere with vibration. This big lumpy area will not transmit the normal soft vibration of the vocal cords, and thus it'll alter the sound. Now, because the closure is bad, the voice once again becomes breathy. And because you're constantly losing your air while you're speaking, it decreases your stamina or the length of time that each breath will last while you're speaking. How do we treat these? Again, we start with voice rehab, a short course to help decrease the stress on your voice. Because the rehab often will not completely help the polyp regress so that it's totally gone, a small surgical removal may be necessary in selected cases. It depends on what your voice box looks like at the end of your rehabilitation. So how do you know what to do if you ever develop any of these problems? Again, you and your surgeon, your laryngologist, should sit together and discuss details based on how certain is the diagnosis, how sure are you that I have a polyp versus a nodule versus something more concerning, your other health concerns, whether you have high blood pressure, any concerns about anxiety or other fears, your schedule, how much time can you take off to have something done for your voice box? You need to go back to work immediately the same day after a procedure, or could you take about a week off? As well as, most importantly, your ability to be still and tolerate a surgery or injection under local anesthesia. If you are too nervous or anxious or afraid, then surgery in the office is probably not a good idea. However, if you think that you can remain calm with a good local anesthetic and you have concerns about missing work, there are good options which can be done in the office setting. So let's talk about some tips now to make sure that you can preserve your voice. So first, make sure you hydrate. Now, in our society, we talk a lot about hydration, and there's a lot of products that are on the market to help you hydrate, but there's a few little things that some of these companies may not be telling you. So hydration does not include anything with caffeine, high fructose corn syrup, or carbonation. So I would encourage you to look at the ingredients list on the products that you're purchasing. And while I'm not saying that you shouldn't or can't have your Diet Coke or Dr. Pepper, my personal caffeine drug of choice, we need to moderate them, consume them at the right times and in the right amounts, and balance each ounce of caffeinated beverage that you have with a glass of water. Now, that water can be plain or flavored with either fruit extracts, which you juice yourself, or there are also some commercially available products which contain natural sweeteners rather than artificial ones, and these will still count as hydration. The more you speak, the more water evaporates from your lips and tongue and your gums and throat. Therefore, the more you rely on your voice, the more important your hydration becomes. Next, avoid inhaled irritants, chiefly tobacco inhalation. This is often a problem in certain social settings. However, Houston has made great advances in narrowing people's unwanted exposure to tobacco while maintaining the rights of smokers so that we could all enjoy our social venues together. But it's not just tobacco, it's other inhaled irritants. We're getting out of the season for barbecuing, but we certainly don't want to stand in the smoke cloud while anyone's frying their turkey or barbecuing on the grill. Stand upwind and you'll have an easier time. Keep clear of infection. Physician, obey your own advice, right? Wash your hands often, particularly if you spend a lot of time with children who are in daycare or in school. And once you keep your hands clean, also keep them away from your face. Sometimes when we are become mindless at our desks, we can lean on our hands or pick at our eyelashes, but bringing your hands to your face is essentially bringing the whole world and everything that you've touched up towards some of the most sensitive areas of your body, all of which are portals of entry for infection. Finally, check your medications. Certain antihistamines and diuretic medications or water pills can dry you out. The antihistamines can dry you out without affecting your hydration status like we talked about above. It's not that you're going to the bathroom so much. It's more that they change the quality of the lubricant secretions, the mucus that you need for your vocal cords and throat to work well. So if you're over-drying yourself in an attempt to treat your allergies, you may want to consult with an otolaryngologist to give you a better treatment regimen so that you can balance your relief and ability to breathe comfortably through your nose and avoid itchy eyes with the natural lubrication that you require. Now, this is a season when we need this reminder. We should be moderate with alcohol. Alcohol is a disinhibitor, which means it's kind of a personality enhancer. It doesn't make you better, it just makes you more of the person that you are. So if you tend to be talkative when you're in your natural state, alcohol will remove even more of your barriers and you will tend to talk louder and more than you would in your natural state. Does anybody in the audience know a quiet drunk? I know I don't. And so it's important for us to be moderate with our alcohol intake. It also dehydrates. Alcohol makes you go to the bathroom. Therefore, it's fighting against the hydration that we spoke about on the previous slide. Now, watch your meals. We want to keep fat and sugar to a minimum, particularly in the evenings. And as I said before, distance food and bed by about 2 to 3 hours. I like to think that this rule gives me a little bit of an excuse to make sure that I eat my dessert first so that my ending of my meal is good and solid protein and whole grain and I have a better balance as I'm going to bed 3 hours later. We should keep our friends close. This goes along with our use of the confidential voice. Particularly in party settings, we want to use attention-getting mechanisms like waving our hands or maybe even flashing lights rather than shouting over others for ourselves to be heard. We don't want to put too much pressure on the voice box by stage whispering also. So what I would recommend would be when you need to speak with someone, particularly in a noisy room, You hold them by the shoulder and bring them close to you so that they can hear you. This will reduce your need to project and talk over the background noise. Now, finally, it's important that you listen to your body. You know when things aren't exactly right, and you should rest when your voice tells you to. Again, in this season of party gatherings, uh, social scientists will tell us that the favorite person at the party is the person who actually listened to other people, not the person who told all their own stories. So if you feel like you have a voice concern but still have a party to go to, don't feel the need to isolate yourself. Go, speak in minimal, quiet voice, and then listen to others. You'll actually make a stellar impression that way. So, some important reminders about when it's imperative, a must, that you see a doctor. When you have pain while speaking or swallowing, if it takes you more effort, more work to make your voice, if you notice an increased air escape or breathiness to your voice, or a change in how long each breath lasts, such that your sentences need to be shorter for you to get through them. If you have swallowing problems that can show up as coughing or choking while you're eating, or any voice change that lasts more than 2 weeks. These can be signs of a serious medical disorder other than the ones that we've discussed today and require visit with a physician who can examine and diagnose your larynx and set a plan up with you. I thank you so much for your time, and we're going to take some questions now. Um, I hope we've been helpful. Okay, we have a question from Tracy S. Is there anything I should be drinking to help my voice? Is water best? I would say yes. Water is the best thing that you could be drinking. And when I say water, I'm not necessarily meaning delivered water. Any kind of filtered or purified water, whether that's a home filter or just distilling it at home, uh, can lead to good water. We have great tap water here in Houston, and so I would encourage you to take advantage of that. Water is the best thing. If you don't have water, anything with a moderate sugar intake, a moderate sugar content is going to be a good choice. So hydrate, hydrate, hydrate. We have another question from Maria who asks, is any specific tea best for the voice? I happen to be a tea drinker, and uh, one of the good benefits of tea is that you're drinking a warm beverage, which also includes kind of a steam inhalation while you're doing it. And the teas that are best for the voice are usually going to be the ones that are decaffeinated. Now, those are often actually not tea, but an herbal infusion. Anything that's not made from the tea leaf of the tea plant is actually not a tea, but any of these warm herbal infusions is good, so long as we're not adding excessive sugar content to them. So I would encourage you to drink any tea which soothes your throat and lets you drink as much tea as you can. Pardon me. So I don't have a specific brand or kind of tea recommendation, but tea is certainly on the list of things which are okay and good to drink. Question from Susan L. Will cough drops alone help soothe my voice and throat? Cough drops should be considered an over-the-counter medication. So they usually contain a medicine called menthol. What the menthol does, it generates vapors which will help decongest the nose, and they can also increase the secretion of saliva, so your lubrication will be better. If you need cough drops for your voice and throat for more than 7 days, the labeling usually will say that you need to see a physician. A voice problem, again, that lasts more than 2 weeks is something that needs to be checked out. If you're using them only in circumstances where you're overusing your voice, then I would recommend that you consider a regimen where you learn to take care of the voice and use it and produce it well so that you don't actually need the cough drops afterwards, if that's something that you're doing. But cough drops are fine for a brief period of time. Like all over-the-counter cold and cough remedies, they should be used for a limited time before you see a physician to get help. We're open for any questions that you have related to your voice health or any other ear, nose, and throat concerns. Okay, another question from Susan L. I have really bad allergies. Does this also contribute to throat and voice problems? Well, it depends on how your allergies are showing up. If your allergies are resulting in excessive nasal dripping, which goes backwards, essentially you're dripping mucus down into the throat, and it can induce an inflammation there too. So you can get swelling of the vocal cords, and when the vocal cords swell, they're not going to make their best sound. It's fairly rare for people to have allergies that are isolated only to their voice box, but you can get really bad throat itching from bad allergies in your nose, and you can also be dripping material backwards down into your voice box. So we usually will work in close collaboration as otolaryngologists with our asthma and allergy colleagues who treat allergists who treat problems in the nose, and people who have allergies in the nose and throat need to get them under control because they can contribute to problems in the voice and the throat. Thank you so much for being so engaged, Susan. Ladies and gentlemen, I thank you for your time, and feel free to visit our website, www.texasvoice.org, for more information. Have a blessed day.